So before we jump into the episode, a quick disclaimer. While I was talking, I was saying physician's assistant with an S at the end of physician. However, the right way of saying it is physician assistant, no S at the end. With that being said, enjoy the episode. Welcome back to another episode of the PT Lounge. This is episode 4. I'm here to do interviews with healthcare providers to learn about their life and their career. On this episode, I have my friend Sammy, who's a physician's assistant. So welcome on to the podcast. I appreciate you for coming on.
Thank you. I'm still a student.
Yeah. Oh, yeah.
So I was like,
She's a physician's assistant student. First, let's just talk about who you are and what do you do.
Okay. So my name's Sammy. I'm currently a second-year PA student. I'm on my rotation year right now, so just going through different places, different specialties. And I think that's mainly it, like what PA school is like right now, trying to balance my life whenever I have time to study because we have exams going on. Then we have to start prepping for our boards. So just stuff like that.
Yeah. So you're reaching the end of your schooling, right?
Yeah. So there's like 6 more months left, I believe, because we end around like Halloween time. And our program's kind of like 2.5 years, like 27, 28 months.
Okay.
So almost done.
Almost.
But I'm like, oh my gosh, I can't believe I'm almost done.
Yeah, you're almost there.
Yeah.
Let's talk about how you got to where you are now. What's the journey been like getting to PA school?
Okay. So I did undergrad here in Las Vegas at UNLV. So initially at first, what happened was like everybody's like in biology, right, as a major, because you don't know, like, do I want to be in pre-med, dental, like pre-PA, like, you know, other like medical professions out there.
Mm-hmm.
So before I started undergrad, like a lot of like my high school friends and I were like, okay, let's go to med school. Like, let's like just do biology and then go from there. And then when I did undergrad, like my first 2 years, I was kind of like, is this what I want? Because a lot of people in my program, like, the stereotyping is kind of like very cutthroat. Everyone's like very, like, you know, studying by themselves, trying to like ace everything. And you're kind of like one-upping up each other. And I didn't like that. So I was like, do I want to spend like 4 years of med school with like this kind of cutthroat atmosphere? Not saying like the people, because, you know, people are really nice. You just don't know.
Yeah.
But it's just that atmosphere. Like, am I going to be okay with it? Am I going to, you know, suffocate or anything like that? And then I ventured out into like the PA field. And so how I first started like getting to know about PAs is actually through my primary care provider. So I didn't see like the doctor I usually saw. I saw somebody else, and she was like really nice. And so I kind of like asked her about it because I did research beforehand. And then she told me what she was doing. So physician assistants, basically like you see your own patients, you help with treatment plans. You're basically like a collaborator with your physician. They are your supervising physician though as well. So you kind of like work with them as a team member, trying to make like the best possible like therapeutic plan for your patients going from there. So I kind of like that because you can basically have flexibility as well for PAs to do any specialty you want to, kind of like learn more in each specialty if you like. So, oh my gosh, I'm going off board. So basically why I chose PA was because of the flexibility.
Yeah.
And being able to learn more, because, you know, life doesn't just stop at like, okay, you know this, and I'm just going to stop here. And I think learning is very fun, and you just get to basically like venture out into exploring what you can do and gain more skills. And that's what I really like about PAs. Moreover, like other professions, just that type of like aspect really interests me. So that's how I kind of started going into like the pre-PA field and like doing my prereqs at UNLV, and then doing more extracurriculars. And then I opened I worked with other classmates that was at school with me, and we kind of created this club, like pre-PA club at UNLV, because we didn't have that at all. And it was just like pre-med clubs. So like if you're in pharmacy, like dental, like everybody's
pretty
like,
general.
Yeah, pretty general. So I kind of wanted one specifically for us, so just so like anybody who was lost like us could know like what's going on, like what prereqs do I need, what should I do, like what shadowing experiences do I need, and we also need clinical hours. So just kind of like being able to help anyone answer those questions would help them along their journey as well of what we went through. Just to help as a guide.
Yeah, gotcha. So through all that process, you kind of figured out you wanted to do PA. Mm-hmm. What was the process like picking a graduate school?
So there's a lot, actually. So it was kind of hard. And I think I picked the programs based on locations. So I want to stay on like the West Coast, like California, Nevada, like maybe Pacific Northwest in the future. So I kind of wanted to do more programs just on, you know, like our side of the country.
Right, yeah.
And then I applied to any selected few that was in the East Coast. And it really depends on your prereqs because every program's different. Some would be like, oh, I want you to have like 1 year of Spanish. And then some would be like, I want you to take a whole year of biochem. And then some are like just 1 semester of biochem. So it really depends on like what programs you want to look into. And if you want to do like a 2.5 year versus a 2 year versus a 3 year program.
Oh, so there's more.
Yeah.
Like accelerated.
Yeah, there are
times.
accelerated programs, but I wouldn't know specifically like what the 2 year programs are like compared to like mine, which is 2.5.
Yeah.
Because some don't have a cadaver lab course, which kind of expedite the process of like the learning, but some do still have it.
Does yours have a cadaver?
Yeah.
Yeah.
Yeah. So during our first session, we kind of like.
And I think that's really important to have because in PT school, our first summer we just did cadavers, and that really set the basis of understanding what the body's like. And as a medical professional, we're dealing with people all day. So I think it's important to have that. Did you feel like that made a difference in your curriculum as a PA student?
Well, I think at first it did because, you know, like when you first start off school, like I don't know if PT school is the same, but you basically do kind of like your prereqs again. So like your anatomy, your physiology, like neuroscience, like the whole shebang, right?
Yeah.
So you're kind of like learning everything again. So I think it kind of helps you learn like, okay, well, I'm going through this system right now and we're going to have this in cadaver lab. So it kind of helps you like reflect like, oh, okay, this makes sense because the liver's on this side or the spleen's on this side. And then it kind of makes sense like where all the arteries are connected or anything like that. So it did help in a way. But I think we have it like once a week. So then we just go back in anytime at our own time when it's still open.
Yeah.
Just to go back in and look through it again before we have like practicals and stuff like that.
Yeah. One of the things that I always think about whenever I'm dealing with a patient that has any sort of liver issues is sometimes I forget where the liver is.
Oh, yeah.
And so I always think about, I still remember when I was doing the dissection for the liver, and I remember which direction the cadaver was facing. And so it's pretty odd. I always think about the cadavers whenever I think about like when I treat patients with different organ failures. But okay, so you decided to apply for graduate school. What are some of the most important things that mattered to you? For me, it was kind of where the location was, how much the school was, the faculty. What are some of those things that were important?
So for me, like I basically like grew up doing a lot of like community service. So I wanted to go to a program that kind of like gives back to its community. So I'm going to Toro right now. So Toro has like a mobile health clinic where you basically venture out into the community and help those who, you know, don't have insurance or any care. So you basically go and see them to see how they're doing and kind of help out from there. So it's kind of like similar to street medicine. So I kind of want to venture out into that because when you become a clinician or a provider, you don't just see like one population, you see the overall. And so I felt like Toro gives you an opportunity to be able to see all different aspects of what the population could be. Because, you know, it kind of helps you grow your communication skills set, you know, just to make sure you kind of learn how, you know, to have empathy, like being able to figure out like what their needs are based on, you know, like their socioeconomic status, what we can do, because every person is different. So you want to personalize a plan that's good for them. So I feel like Toro kind of helps you set up like a good way to, you know, figure out what you can do as a clinician, you know, like when you graduate. Because I feel like that's really important to be able to be, you know, like staying humble, being able to know like you're not just seeing like just one set of a population. Like there's just so much out there. It's so diverse. And, you know, like Southern Nevada is always in need of new providers. And I think Toro is providing a good connection for us kind of like dip our toes in there so we know what we're getting into and how like it's the most effective way to help them. Yeah.
Definitely. Does Toro have an interview process that you learned about these programs in the school?
Like, wait, can you kind of
like for UNLV, we go through an interview process where we go in person and the staff interviews us and we get to learn about all the things that UNLV has. Compared to Toro Physical Therapy, they don't have an interview process, so you basically just apply for Toro Physical Therapy and they send you an acceptance or not. And so there was a big difference in terms of which school I went to because UNLV, I knew exactly what they did and what they didn't do. Did that make a difference to you? Like, did you know that Toro has these programs that you were interested in, or was it just like, okay, I got accepted?
So all the programs, like including Toro that I applied to, so all of them do have an interview process. And so it's kind of like it could be like a 4 hour or like a, you know, a long day process
Yeah.
of the interview. So they will have like probably an interview as a group or like solo one-on-one with a faculty or two faculty to one student. So it depends on the program. But for Toro, I don't know if it changed, but when I applied, it was like a group interview on Zoom just because of COVID and the pandemic, you know, keeping everybody safe. So there was like two faculty members and then like there was like other candidates that was in this interview with me, and they just basically asked questions and then they kind of pick like who goes first answers, and then you kind of just bounce around going from there. But like based on my other interviews, they did just do like a one-on-one, just trying to get to know you. And then another one would be kind of like a MMI type of style where they kind of give you scenarios and you kind of have to answer that type of scenario, how you would solve it basically, and go from there.
Okay. Did you enjoy your interview process with Toro?
I did. I think that was like the most relaxed interview I had.
Oh, yeah.
Because I think like when you go into like any interview process, like I don't know how you felt. You can let me know after.
Yeah.
Like I feel like you can't be too nervous. Like you can't be like too like, you know, tight about the whole situation. You just have to be relaxed, because when you overthink it or when you're like, oh my God, maybe I'm going next, you're going to forget what you're, you know, like what the question is, what you're going to say.
Yeah.
So I feel like you should go into the program with an open mind, trying to learn what they're telling you, what their mission is, you know, like how financial aid works, because they will tell you that during the interview process as well, because they kind of go through the programs that they have at school in case, you know, you don't get in. They do have like a post-bac, blah, 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 going from there. So, yeah. I mean, I think you just have to be kind of like laid back and just know that you're there for a reason. Like you have been selected for an interview because they see potential in you. Like you just had to go from there and think positive.
Yeah.
Is how I felt like, but
definitely. Mine was probably the best interview I've ever had. UNLV made it really calm and exciting for us. It was essentially half a day to a full day, because half the day was interviews, and then after that we were invited to a park day where we met all the potential students.
Okay.
And I just felt like at home. And so I think the interview day really made a difference. I want to focus this interview on your perspective as a student going into becoming a physician's assistant soon. To start, how many schools did you apply for? How many did you originally try to apply for versus what you actually did? Okay. I'm always interested in that.
Okay, so the application process. So we use something called CASPA. So I think a lot of programs have something with like ASPA at the end or something. I'm not sure. But, or like a very similar style system, because I think PT school had a similar system.
Yeah, ours was PT CAS.
Yeah, like CAS, like somewhere in between. So for me, I applied 2 cycles actually. The first cycle I applied, I was still in undergrad, so I was kind of like still preparing, but I just wanted to see what my chances were like to get in, and as well as kind of like growing my interview skills. So like in case I don't get in the first time, second time, I know how to prepare myself more. So the first time I applied to like 8 schools. So I got like waitlisted to one of the schools, which was USC. That was like one of the top choices I really want to get into, because they do street medicine. And one of the professors there like was the one who kind of invented that for the PAs. And he's like from Philadelphia. So now he's like working with USC. So I was like, it would be great to work with him and learn from him as well. Yeah. But it's a 3-year program. It is like super expensive because it's a private school. And then, so that's all I heard from my first cycle. And then the second cycle, I felt more ready because I had like more hours, because we need clinical hours or like patient care hours. And then I got like more literate regs and basically finishing like more of my courses. So it kind of prepped me a little more. And then I applied to like, I think about 15 schools for my second round. Yeah. And then the second round, I had like 5 interviews, and then I got into Toro, and then I got listed to 4. Okay. Yeah. So I was like, oh, that's not bad. I'm like, at least I have more like chances to kind of like interview and kind of, you know, get a grasp of like what it's like per program and if I like them or not. Yeah. But I think after you interview, you kind of have a feeling like if you vibe with them or not. I feel like that's really important. So. Definitely. Yeah.
I only really interviewed to one school, which was UNLV. Other schools I was accepted to, but there was really no interview process. So I got accepted to Toro Physical Therapy, where they didn't have an interview process. And I said yes, and I paid the down deposit. And then 2 weeks later, I got accepted to UNLV. And so I was like, wow, I kind of just wasted all my money for Toro. Yeah. But so now that you're in Toro, about 2 years in, what are your thoughts about physician's assistant in general? Like, is it something that you always expected it to be? Or are there things that still surprise you to this day? Like, wow, I got into this and not knowing that this is what it actually is.
I think it kind of reinforces like, wow, this is exactly what I want to get into in the first place.
That's good.
Because it's like they can do a lot of hands-on, stuff, and they can see their own patients and go from there. And also like build a relationship with their patients, because that's what I like the most, being able to talk to them.
For sure.
Like not just asking them like, okay, what's going on? It's more like, oh, how's your day been? Like what's your plans after this?
Yeah.
Kind of getting to know them as a person, like overall as well. I feel like that's really important, because you don't want to just be like, okay, I gotta see patient X, Y, and Z, and then like be done with the day, because that's not what it is being a provider. It's kind of like building that connection and kind of like build a trust, because like you can see sometimes when you kind of treat a patient or you talk to them about something, you can see in their eyes like if they trust you or not. Or
right
or
away.
Or like, okay, like, are you sure? Like sometimes
like body language too.
Yeah, or like how they sound. So you want to be confident, like when you talk to them. And I think through Toro and just, didactic year and rotations, and from what I'm seeing, like I'm glad I made this choice, because I feel like, number one, there's a work-life balance. Number two, like you're really able to get to know your patients really well. And then three is just you're constantly learning. And I think that's great, because there's always so much things new out there, like technology, like new treatment plans. And I think it's kind of cool. Like you get to implement that into what you're doing day to day. And I think that's really rewarding. Yeah. So
you talked about work-life balance, and I'm starting to think about how I was during my didactic years.
Yeah.
Work-life balance wasn't even a thing my first year of PT school.
No, it wasn't.
It's just all school on top of school. You essentially work 2 full-time jobs, it felt like, for me. And then my second year of PT school, it felt more tolerable. What is your work-life balance in the beginning of your schooling versus now, 2 years in?
So didactic year, it was kind of like Monday to Friday, like 8 to 3 p.m. or like 8 to 5, depending on like what classes you have and if you have lab. So kind of, I think, pretty similar. Like you're just in class every day, you go home, you have dinner, you shower, you go to sleep. I mean, you can try to study in between, but like for me, like it's so hard to have like an actual study schedule, because for me, I need a little bit of pressure. And then like, kind of cram, which, you shouldn't be doing, but that's just how I am.
We all do it.
It's kind of hard. It's kind of hard to like get out of that habit, but that's just how it is for me. It just helps me learn better. Like when I'm when I'm on the clock, I'm like, okay, let's go through my Anki cards right now.
Yeah.
But yeah, and then weekends were off. So weekends is like when you kind of study more for whatever test that you have going on. So for school-wise, for like how my program works, there's 7 sessions. So each session is like 3 to 4 months. So the first 4 sessions are didactic year. The last 3 are just rotations. So during the first 4 sessions, you have exams back to back. So it could be as many as 2 exams a week or 3 exams a week. It really depends. Like I think faculty tries to be nice about it. Yeah. And being like, okay, let's just give them 2, and then next week 1, and then 3. Bam, the week after, and you're like, oh goodness, I gotta study for everything. And then you have group projects on top of that, and then you're just like constantly trying to like work through it. You're just trying to sleep. And I think it's just all about pulling through and just making sure you know your stuff and how do you utilize your time. Because when you have lecture, do you pay attention 100%?
Not all the time.
Yeah, because there are some where it's like it's on Zoom, and if I'm not trying to say anything about the professors, but it's like if they're mainly just going through the slides with you, you can take that time and make flashcards instead. So it's kind of like optimizing how you would want to use your time. And any resources that you have, like just making sure, okay, if they didn't say this, let me type this down real quick. So kind of like listening to what, selective hearing, like what is important and what you don't think is important to help you study. So there's that. But it was definitely a burnt out though during didactic year, and it goes by fast. Did it go by fast for you?
During my didactic years, it seemed like it was taking forever. But looking back now, those first 2 years of my schooling went by really quick.
Yeah. Because you're just taking exams
You're always on go.
Yeah. And I think you become like a better test taker at the end in a way, because it helps you prepare for your boards. Yeah. So I'm just like, I'm kind of grateful for that, because if I did it, I'd be like, oh my gosh, what's going on? Yeah. Like I wouldn't know how to read a question faster than before, because there's a time limit when we take our test. So they want to time you to do like at least only like max 1 minute per question. So you got to like read through that real quick. So
what type of student are you during those exam days? Because for me, I remember during exam days, I was the type of student that was having my head down. I don't want to talk to anybody. I'm focusing on the exam.
Yeah.
But then I had other classmates who is very chatty and wants to talk to everybody, and that's their way of calming their nerves. Mine was so different. What type of student were you, when you first started?
Okay, so on exam day, I would usually go in like 30 minutes to an hour early, and then I'll sit there, I'll put on my headphones, and then I'll like go through like my last like Anki cards or like the charts or anything like that resources wise that I have right before the exam, so I'm like in the mind of doing it. And then we used to have this ritual with one of my classmates where we listened to one song, which is like Good Things Fall Apart, like right before the exam, because it's like, okay, you're going to think it's going to fall apart, but it's not. Like, you want it to be ironic. So that's why we play that every time before like our exams. And, we passed. So, woohoo. But that's how I was. Like, I would just kind of like quiet person, but I'll talk if I have to. But there will be some people who are like just so loud, and you're like, I'm trying to study. See, I have headphones in, but I think like you said, they're just probably trying to like calm their nerves down,
right? Or
like just not think about the test and then take the test. And then after the test, how there's like some people who actually talk about the test, and then there are people who are like, okay, no, like please not. I'm like the person where I'm like, okay, please not, because I'm already done with the exam. I want to relax. And then there are some people who like literally like go through their slides and be like, okay, this is a question.
That is me. I had to look at my notes after every exam, or else it would make me feel worse if I didn't.
Oh, really?
It was bad. Yeah.
Did you guys like get to basically see what questions you guys got wrong after the exam though, or no?
I don't think so, but I would review my answer, and I was like, okay, I put the wrong answer, so I know I already got that wrong. And then it would be one wrong answer after the other. I was like, oh, I failed that test.
Oh no!
And then it turns out I didn't. But
I just tried not to count because I'm like, I mean, you take the test and then you don't know what you got wrong because they don't tell you. They give you your score back, and I'm like, I don't think the boards will be like this. This is just for the class, so I will just forget about it until I need to go back and review and be like, oh, I got this wrong. I remember because I put this other answer on there. I'm like, okay, great. So, So
going back to the work-life balance, so you said that during the didactic 4 terms, you basically were in school on the weekdays, and then the weekends you would study even more, which is pretty typical. You don't really get a work-life balance. Now that you've transitioned to just your clinical rotations, how has your work-life balance changed, if any?
So our basically rotation. So I have rotations like a new one every month. So every month I'll be like somewhere different, and our schedule depends on the preceptor. So if they only work like 4 days a week, we only work 4 days a week. Or if they only work once a week, we only go once a week. So it depends on like the preceptor. And so in a way, you kind of have to like rely on your schedule to kind of make your own schedule.
Right.
So if you go to clinic, like outpatient clinic, for sure most of the time the weekends are off. So you'll have the weekends to study. But during the weekdays, you're kind of figuring out like how long are they in clinic for, and then afterwards you can study if you want, but if not, then just kind of go through the concepts or like log your patient stuff on the website that you need, just to hold yourself accountable depending on what program you're in, like what patients you saw, so that they know that you're on track for graduation. And then kind of go from there. So it's kind of hard to kind of make a schedule. So when I make plans with anybody, like with the work-life balance, it's hard. Like I would have to say like, oh, I don't know my schedule for next month, so I will let you know if I can have dinner with you.
Right.
So it's kind of hard, but my friends are pretty like understandable, and like I'm kind of happy.
So I'm sure you've had those rotations where it was very hard on your schedule, and then there's some that are pretty easygoing, and you're able to do other things outside of school too then, right?
Well, I think it depends on like obviously the rotations, but like for me, I think luckily I was able to have rotations where the schedules were constant, or I have enough days off that I can utilize to study for my like end of the month or like end of the rotation exams, because those are like really broad, not just based on what rotation I'm on and what I'm learning there, but just the overall topic itself. So,
gotcha. So for someone wanting to go into PA school, or if someone's just interested, can you go through how clinical rotations are picked, or if you get to choose? How does that work for Toro specifically?
So for Toro, we have like a interest form basically that they'll send out like closer to like rotation year. And so what happens is like you basically pick your top 5. So it's going to sound kind of confusing because it's like top 5, but within those top 5 specialties, you kind of choose like what places you want for your rotations. So our clinical director will send out like a list of all these places that we can go to for rotation, and it's up to you to choose based on what interests you.
Yeah.
And go from there. So I have a total of 11 rotations because we have 1 month where it's transition month for us, for like just my cohort. But then I think after our cohort, they're going to have 12 rotations because I think like because COVID is going down slowly.
Right. Yeah.
So I think they're giving more, like going back to normal basically. And so within those 11 rotations, we have 2 family med rotations. So that could be like anything within the category, depending on the program. And then 2 internal medicine rotations, and then 1 surgery rotation, 1 psychiatry, 1 OB-GYN, 1 ER, and 1 pediatric. Rotation. I don't know if I'm counting it right. But yeah, if I'm missing something, people will know. Yeah. But it's just like those are like the core ones that we have to basically go through in order to learn everything that we need and for us to graduate on time, basically.
Gotcha.
And so, like within family med or internal med, so there'll be like different specialties. Like they'll have like ICU or something under internal med, or like inpatient medicine would be under like internal med. And then family medicine could be like urgent care or anything. So it really depends on the school what they would classify as either or to count that towards your graduation. So in a way, like when I did my interest form, I had like OB-GYN like in my top because I really wanted like to have a really good OB-GYN rotation so I can, catch babies, when they're born. I'm like, okay, I need to see how this works in case I have a chance to work in OB-GYN. So I think it's kind of like weighing like what you're more interested in versus not. Like I think some of my friends really wanted derm, so they put that as top. And I think derm is under family med for us. So it really just depends. Or like some people wanted like certain surgeries, so they put that on top as well. So,
yeah. So you have your top 5 of the big categories like family med, internal med, and then you get subcategories of more specific kind of specialties or like locations.
So within like the top 5 specialties, you kind of choose like 3 options per specialty kind of.
And you're choosing which location you want to go to those? Okay.
You can. Or you can mention in the comment section in the survey like, oh, I don't mind where I'm going, or you really want this, precept or anything like that. You can request, but obviously like your cohort has like an X amount of people. Like my cohort has like 80. So, the clinical director can't just accommodate you to that person if they're highly requested as well. Like they'll try to, but it's going to be hard because everybody's going to have a different schedule and they're going to have to like maneuver like 80 kids around. So that's pretty interesting.
For our rotation process, we got to choose which kind of hospital or clinic we were able to go to. And so we had a little bit more control of in-state or out-of-state. It doesn't seem like for Toro, I mean, you get to pick which one you want to go to, but if you don't want to go out of state, do you have that choice?
You do have that choice. So you can put that in the comments, or like as long as whatever you choose, like in your top 5 and they're all in like Nevada, you'll be fine, or just let him know. Because I do have classmates where they're just doing their rotations here.
Okay.
Yeah. And then some that are like, let's say from California, they'll try to set up their own if the school doesn't have enough of like where they want to be in California for like X amount months. And then they'll find their own and then set it up and go from there. Because it's kind of weird because you know how like everybody starts school at a different time.
Right.
Like Toro starts in July, and then because it's a 2.5-year program, not like a full like 3 years or just 2 years. So the lease for some of my classmates are kind of weird. So like they would have to like, let's say after 2 years of leasing their apartment, they're gonna have to like either do a few more months left before graduation or like another whole year. So some people don't want to do like the 3rd year of leasing their getting their apartment again. So they'll like try to like maneuver and find rotations in California or where they're from to just do the rest back home and then come back for graduation.
Could you theoretically stay in one state? Like if you were going to Toro, but you wanted all your rotations in California, is that possible?
That is possible, but just not the community medicine rotation that we have that's required for us, which is related to the mobile health clinic.
Here in Southern Nevada?
Yeah, here in Southern Nevada. Okay. But so out of the 11, community medicine, you would have to stay here most likely. And then the 10, you could do just back whichever state you're from, as long as Toro has enough of those opportunities for you to kind of put on your interest list, or you find some of them on your own.
Okay.
As long as they qualify for surgery, because, you like, for example, surgery has like pre-op. And then surgery and then post-op. So as long as they have like certain components for that rotation and it qualifies, then you'll be fine.
Okay. Gotcha. So you sent me all the rotations that you've done and the ones that you are still yet to do. and this is probably going to be my favorite part of the podcast because I get to
Yeah.
just sit back and let you talk about
Okay.
what these rotations are,
Mhm.
because it's very interesting to me.
Yeah.
I haven't had a guest yet who diversifies into a lot of these situations. So the ones that you sent me, are these in order? Like, was emergency room was that the first one you did?
That was my third one.
Okay, so we'll just go out of
Yeah.
order.
Go out
Essentially,
order. Okay,
I'm gonna
okay.
tell you what the rotation were that you
Okay.
went to.
Okay.
I want you to give me a brief description of what it is and
Mm-hmm.
what a PA's role is in that rotation,
Mm-hmm.
and just your general thoughts. Like, did you like it? Did you not? Or any specific stories?
Mm-hmm.
Let's start with the one of the clinical rotations you had in the emergency room.
Okay. The ER.
The ER.
Sorry. Oh my God. The ER. Okay. So let's start off with what the time is like for the ER. So it varies. So you're either following a PA around all the time, or a doctor or a resident. So like it really depends on the shift. So when I'm with the PAs, you basically see patients, that are that need to do a rapid assessment. So you're just trying to figure out what's going on, get their story, order labs, and see if there's anything, abnormal. And then depending on acuity of the patient, like how complex they are, you might have to stack it with a physician. So like a physician will also go see them if it's a very complex case. So it depends on the hospital, because acuity-wise, it can go from 1 to 5, and 1 could be the highest, 5 could be the lowest. And I think some other hospitals, like 5 is like the highest and 1 is the
It's like
lowest.
opposite.
So it depends on the hospital. But when I'm with the PAs, I can like see patients on my own and like before they're seen by like anybody else.
Okay.
So trying to like figure out like, okay, what's going on, get the whole overall picture, and I'll go report back basically to my preceptor or the PA, and then let them know what's going on with this patient. Like 42-year-old female presenting with this and this and this for X amount of time, constant, where does it radiate, like the whole shebang with the HPI. And then sometimes they'll like ask you like, okay, what do you want to order? And then I'll be there. I'm like, I think this and this, but like I'm not sure, because some, like providers have a certain like, I guess, go-to that they would want to order.
Right.
Like
yeah.
they'll have it like kind of like customized on their system already.
Mm-hmm.
And then they'll order that. So it really depends on your provider, just to know what to order. And then after that, you see another patient. So they'll see like 20, 30, sometimes like up to 40 patients in like a 10-hour shift.
Yeah.
So in a way, like they'll tell you like who to go see. And then you're like, okay, let's go see. And then you do like a whole physical exam. So the ER, I had to like learn like, what am I going to do? Like, okay, like let's listen to the heart and lungs. Let's do the neuro, exam. Let's make sure they're okay, not having a stroke. So I think the ER was very like a good rotation to learn how to examine the patient and knowing what to ask. Because I like have never done anything like ER related.
Mm-hmm.
So, like you got to be urgent. You got to be like, okay, what's going to kill the patient? But for me, I was like, I don't know what's going to kill the patient right now. And then so I'm like, because I went in blind for that rotation because I don't know what to expect. And everything. So I just wanted to like open my eyes and just learn as much as I can. So that's just kind of like how it went. Like I was just like, okay.
I'm sure you learned a lot.
Yeah, I was like, okay, all right. This person said, okay, I should order this and that. And then we don't really get to, like see the end, I guess, of the progress of the patient. Like
You're the
what
start.
happened.
You just hand off.
Just hand off. And then it's
almost like a triage.
Yeah, it's kind of like triage.
Yeah, okay.
So sometimes you don't even know what the labs say because you're just seeing so many patients. You're trying to get them in. You're trying to make sure they're just stable, and then they can be discharged. Or unless they need to be seen by a physician or resident as well, and then they're okay to be discharged, and that's fine. Or unless they need to be admitted.
Yeah.
So it really just depends. So yeah, I saw like so many different like patients in the ER. It was kind of crazy.
Yeah.
Like some of them, like I feel bad because it's like they're tired from waiting, and it's like, okay, I know, like you're kind of on the edge, but let's just kind of get this through. Like tell me your story, what's going on. So sometimes like you just had to, like be like, I understand, what's, like you've been waiting for a long time. You're dealing with this, like you just had to let them know that you understand like what's going on. Or like how they're feeling sometimes, instead of just like doing everything fast, because then they're gonna feel like, okay, like why did I come here in the first place?
And and for some of those people, they waited so long only to do a quick assessment.
Yeah.
I'm sure it's trying to find a balance of how much can I do this in an efficient way, but also, making good time.
Yeah.
So
So
like
it's kind
and
of
caring for them.
Yeah. And then I got some. So I think one of the fun ones in the ER was like just doing laceration repairs.
Oh, okay.
Because I'm like, because every provider is different.
Yeah.
Like the way that you hold like the hemostat for like, you know, like the stitches and stuff.
Yeah.
It's like different per person. And so my preceptor was like, you just put your thumb in the hole of the hemostat. That's it. And like some people, like, because you're not supposed to put 2 fingers in there.
Yeah.
Or whatnot. Because it's like, you can't really get a good grip to like, if you have to unlock it and then suture and everything like that.
Yeah.
And it's different from learning in school, because school would tell you like you need to do 3 throws of the suture, but then like when I'm in ER, they're like just do 4 because it looks nicer and it's like more like tight and like looks good, and that it's secured. So it really depends on the person. So I thought that was pretty cool. So and then stapling too. I mean you're just stapling.
Yeah.
But suturing was like the fun part. I felt like that was like the most hands-on stuff I got to do. I didn't get to do any like incision or drainage the month I was there, because we didn't have that much. And it's kind of like where you see one, you do one. I saw one, and then the second person never came, and I'm like, oh, I cannot put this on my log because I didn't get to do it. But it would have been fun if I got to do it.
Yeah, definitely.
But yeah, and then when I'm with the doctors or residents, you can see patients with them, or they already been seen, and they'll have you practice and go see them, and then present to the doctor or to the resident again, and then kind of go from there. And you kind of see more complex cases or see people getting intubated. I haven't done a chest compression in the ER. Surprisingly, I thought I was going to, but I didn't. I was like,
that would be intense.
Yeah, I know. I was like, oh,
that's good. That seems very interesting. ER, I'm sure it's very hectic and fast-paced.
I think it really just depends on your personality and how you like it. Like, I heard like one of my friends saying like they want to do ER because you're just seeing patients all the time. It's like, do you want the continuity of care, or do you just want to see patients that are in urgent needs or emergent needs? Like it really depends on like what your style is and like how you are. So
yeah, because if you want to see that continuation of care, ER is probably not for you.
Yeah.
So let's bring the question. ER, is it for Sammy or is it not for Sammy?
Okay, I feel like I've been saying no, but I feel like I would be interested if that is like one of the job opportunities out there when I start off as a new grad. I think I wouldn't mind.
Yeah.
Yeah. But there's a thing, I don't know if it's like 100% true. I always hear it from my classmates where they're like, oh, after 2 years, working in the ER as a PA, you can switch now. You can move on.
Okay, so there's a kind of a time period
yeah, there's
where
like a burnout basically. Like I know like one of my preceptors like worked in the ER for like 7 years. And I'm like, okay, she's suited for the ER. That's why. Like she's
you
ER
have to
built.
have I feel like you have to have a certain personality where you're okay with being on the go all the time and you thrive off of that.
Yeah.
If not, I can't even imagine like 6 months in an ER without being burnt out.
I don't know why, but I think it really depends on like how you like your surrounding or like the architecture of the building.
Yeah.
Because sometimes you'll feel like it's kind of stuffy in there, or there's just like no windows. Like when there's no windows, like there's no sun, you just feel so like depressed.
You're surrounded by 4 walls and
and you're just like, oh my god, I've been here for how long? Yeah. So.
No, definitely very different. All right, next clinical rotation, pediatrics. Talk a little bit more about that.
Okay, so I personally like peds because I did like I was like an MA at like a pediatric surgery office before I started PA school.
Oh, nice.
So I was like, okay, maybe peds is for me because I like talking to the parents. Like I like seeing the kids. So I was like, okay, yeah, I did like peds like when I did it last month because I like just had it like recently. It's a lot of like viral like infections going on, a lot of like fevers, coughing, like allergy season or like strep throat. So I think because it's like an outpatient clinic, so you see a lot of like the normals and you see a lot of well checks. So just seeing like, okay, like are they meeting their milestones? Like are they talking now, or like what is it called? Like saying mom or dad, or like are they counting? Are they, moving their hands? So it's kind of like knowing those things and like asking mom how they're doing. So in a way, I kind of liked it. I just don't know if I'm a person for well checks. Yeah. Because I'm like, it's like you're just checking to see how they're doing, but you're not really using too much like clinical knowledge.
Gotcha.
Like in a way, like you're just checking like just progress, which is nice, like because you get to have a conversation with the family. Right. But I kind of like, I like this part, but I kind of want to do a little more. So in a way, I'm like, I kind of like peds. Like,
but if you could use your clinical judgment and
do a little more hands-on, I think it would be nice. But I'm still content with it just because like I love seeing kids. Gotcha. Got to hold them and stuff too. I'm like, they're so cute. Like I would definitely be here. Yeah. So it's nice though.
So it's a maybe.
Yeah. So it's like a maybe right now. Like I thought I would like love it. I love it, but not like super love it. I guess if that makes sense. Yeah.
What do you think a physician's assistant student needs to have in terms of personality or traits in order to succeed in pediatrics?
I think you just have to like have like a bubbly personality, I feel like, because like you just, because kids are scared.
Yeah.
Like if you're wearing like a white coat or like with a mask on and they don't know who you are, they get like stranger danger. So they're
Right.
like, oh my God, like who is this? Like why are they here? And then the moment you start touching them, they're like yelling and screaming. So you kind of need to have patience as well.
Yeah.
Because like, let's say you have to look in their ear, but you can't because they're moving. You have to find ways to like have mom help you. This is a group effort, so let's go ahead and like, you hold the baby. I'm gonna look in his ear. So hold his head real quick, and you just gotta look in there real quick, and then go from there. So you're just kind of like had to find ways to maneuver, of like, I guess, how to work around the patient for like peds in general, because they're not like adults. Like you can't ask them like, did you spit out blood? Because then like sometimes they're still growing,
right,
their muscles and stuff, so they can't just spit out stuff all of a sudden unless something really happens. So in a way, you just have to have a bright personality, be very positive, because you don't know what parents are always gonna say, and then they're extra worried, so you're gonna have to be reassuring. You gotta be calm.
Pediatrics is a different world for me.
No, yeah.
You have two patients. You have the child and you have the parent.
Yeah, and then sometimes you forget, like, oh, you can't ask the baby, like, did this happen to you, or like, did you have the symptom? You can't. You have to ask the parent.
Yeah.
And the parent can only say so much because they're also like observing how baby's doing. So,
right.
You're never 100% sure, like.
And
what
they probably don't have the
have.
medical knowledge too to like, if a parent is asked about this and that, they probably don't know.
Yeah.
Because they don't have much knowledge about that.
Yeah.
So it's very different.
Yeah, it's a lot of patient education as well. Because I think like for anybody being like first-time parents, you just don't know what to give to your kid. Like you feel like once they start having a fever, you're like, oh shoot, like what's going on? Like I need to take you to the urgent care, or I need to take you to your primary right now.
And then they're gonna rely on you, Sammy, to make sure.
Yeah, let's take the temperature. Any other symptoms? I'm like, okay.
Yeah.
Kind of be reassuring.
Gotcha. All right, next one, inpatient medicine. What is that? What is the role as a PA student, and did you like it?
So for like as a PA student, so I would kind of so it's kind of like doing rounds in a hospital.
Okay, so this is inpatient in like a hospital based.
Yeah. Okay. So I'm with like an IM doctor. So IM doctors basically, they're the hospitalist, right? So you basically have like X amount of patients that are admitted that you're seeing for that day. Sometimes it could be like from 20 to 30. So it really depends on like how big the hospital is, how heavy the load is. So then you'll split among with like, other doctors and everything. And then I would follow them and go see each patient and see how they're doing. So all of them are coming in for something different. Sometimes it could be like for like MI, or like could be like they have like a skin infection, like diabetes, anything like that needs to get under control. So in a way, like following them, you just kind of see like how they examine a patient. Like, okay, like are they doing well, breathing well, heart sounds good. Basically it depends on what they're coming in for. You're just checking everything to make sure they're still taking their medication. They're stable. Yeah. So as like a hospitalist, you're just making sure they're stable. And one of the big things that they do is they communicate with the other specialties. So let's say this patient has like a UTI. You're also talking like, and you're, more of an older patient. So they might have other complex conditions. So you're consulting infectious disease, you're consulting urology. You're going to see what they say. So based on what they say, you have to kind of like make sure everybody's like on top of it. We know what we're going to do for the patient. So you're not just making sure, oh, okay, they're doing well, but you want to make sure you check what the specialists are saying, and that we're on top of that as well. So there's this thing too, like misconception where patient always feel like, why do they want to kick me out of the hospital? Like why are like the turnover so high? And then one of the reasons is because when you're in a hospital, you're at a risk of infection, like MRSA, right? Like you're just more likely to get sick when you're in the hospital because there's just more, stuff going on. So, we want to minimize your risk of getting something new on top of what you're coming in for.
Right.
So it's like, okay, like, yeah, once you're done with the antibiotics, you're stable, you're doing well. We want to discharge you so you can finish the rest of the regimen at home. So, preventing you from getting even more sick.
Right. Yeah. So, that makes sense.
So, yeah. So that's why, like, we try to tell them, like, oh, as long as you're doing well, you're able to go home. We want to give them their independence. We want to make sure the quality of life is still the same.
Gotcha.
So.
Yeah.
Like that. And then I think like when, like when the PA does, do hospitalist work, you do still work with the physician. You will have like your own list of patients that you're going to see as well. And then you basically chart similar to what the physicians do. Then you just touch base with them with any complex cases that you have questions on, and just to check if they're also okay with it.
Gotcha.
And then go from there. And I think it really depends on where you work. So I had this rotation in California, so it's 12-hour shifts, like 8 to 8 or something. So you see patients, and then the rest of the time you're charting, unless the nurse calls you, and they're like, oh, BP's dropping or potassium's low. Like, what are you gonna do? So it's kind of like providing.
So is it 312s or you're working more than that?
So the physicians work like 1 week on of like 12-hour shifts, and then 1 week
7/12s, and then okay.
Yeah, so it's like 1 week off, 1 week on, but it really depends on the company you're working for that hospital, because sometimes you can work just 2 weeks and then you have 2 weeks off. So it's kind of flexible, like how you want it. So.
Was that the first time you've done 7 on, 7 off?
Yeah.
How was it?
It was. So I got to leave a little early because it was like when they're charting, they're like, you can go home. I think they were just being nice. So I'm like, oh, are you sure? Like, you don't want me to do anything else? But this particular like hospital I was at, there was a lot of like Asian like patients. So I was able to like learn my Chinese and like say certain things. So like I wouldn't say my Chinese is like the best. Like I can do like conversational, like speaking and stuff like that. So I would try to like describe things. And one of the funny things was like one of the doctors like, can you ask them what their like heart ejection fraction is? And I was like, like in Chinese, like, did you, get this like echo done or like this kind of test done? Do you have that paper with you? So luckily, like this patient did. So I was like, oh, the ejection fraction's right here.
Oh.
So I'm like, oh my God, I would not know how to like explain it. I'll be like, oh, like your heart is pumping.
Yeah.
Is it pumping well enough? That's all I can say in Chinese. Yeah. But yeah, so it was kind of like practicing it.
Do you feel like you've used your Chinese a lot in your clinical rotations?
Only in California is what I noticed, because I think they have a bigger Asian population there. But here, not really.
Gotcha.
But I think they're practicing it. It kind of made me feel like, okay, like I wouldn't mind having more of like an Asian population to serve as well, like in the future. Yeah. And just to help practice, I feel like you feel a different type of like closeness, like when you're, I guess, treating someone that also speaks Chinese, because it's just so different. Like,
I agree.
And I think they're appreciative when you try to say like, okay, I could speak a little bit, and then kind of explain from there, because then they won't be like, you suck, like I can't hear you. Like they'll be like very thankful that you're trying to communicate with them and letting you know what's going on, because there's never really like a in-person like on-site translator. They're gonna, because it's usually online, like where you use an iPad, right?
Yeah, ours is like a phone that's just done through the phone.
Yeah, and sometimes like the connection's not good, so they're kind of lagging. So you're just standing there like awkwardly, like waiting, like for them to
it
talk,
streamlines the communication much better.
Yeah, so
nice. I feel the same way when I have a lot of Filipino patients. It's not like I treat them worse or better just because the goal is to treat everybody with the highest level of professionalism, but you do feel a sense of kind of belonging to be there and closeness to them. Yeah. It's like heartwarming whenever there's someone like Filipino that because you think that it's just kind of your family there too, like it's as if you were my family, like I want to take care of you. So okay, inpatient medicine. It seemed like you enjoyed that one.
Yeah, I think it was pretty nice. Yeah, just to see like how the lifestyle was with their work-life balance. I was like, I could see myself doing that. 1 week on, 1 week off. Yeah, just keep doing that. That's nice. So, yeah.
I'm biased. I work in a hospital, so I love inpatient and I love the work-life balance, and I love being kind of the transitionary point from when someone is sick to going home. So I love anything inpatient. Yeah. Okay, next one. I think you're going to really love talking about this, the OBGYN or OB-GYN.
Oh, yeah. Okay. Actually, that's like one of my favorite rotations so far. Yeah. It was my very first rotation. Okay. Yeah. So this one I was able to have like the GYN part and the OB part. So,
can you talk about the difference between the two?
Yeah. So OB is like more for like pregnant ladies. Like you're basically checking up on them to making sure, their pregnancy stages, like they're doing well, baby's doing well before they're born. And then, you deliver the baby basically. And then the GYN part is more like women's health, where you kind of see like what's going on. It could be anything related to their menstrual cycles, like, and like fibroids, like basically like all different topics that you can think of, like birth control, like if they want to consult about that, or menopause, anything similar to that. So one is like more women's health, and one is more like pregnancy related, if I had to distinguish like the both. But yeah. So.
Gotcha. Cool. So how did you enjoy your rotation?
Well, I liked it because I got to see like a lot in the office, where the doctor basically did like fetal ultrasound. So you kind of see like the baby, where they're at. And then you also get to help with the procedures, like not really like do it yourself, but you get to assist and see, like for example, somebody had like a cyst down there, like, and they need it taken out. Like we had to do like a speculum exam just to look in there, and then kind of like do this like long, like it's not a long procedure, but it's just like the steps, and kind of assisting with that and just seeing like, oh, what's going on. It's kind of cool.
Yeah.
And then at the end, like we can like do like like a pelvic and like a speculum exam, basically like a pap smear.
Yeah.
At the end, so it was pretty cool.
Nice.
But I think it's like everybody's different. So like pap smears are kind of like you just have to figure it out, you know, in a way, because everybody has like, you know, different body.
Yeah, different anatomical features.
Yeah.
Did you enjoy the OB more than the gynecology part?
I think I liked them both. I think I liked OB-GYN more. I mean, not OB-GYN, OB part more, because we would go to the hospital. We'll have like 12-hour shifts, like on call, or like 24 hours. So it really depends on like what shifts my doctor picked up. And then we would follow him to the hospital, to the L&D area. So labor and delivery side of the hospital.
Yep.
And then whoever's ready to, you know, pop the baby out, we're just going to go in there, gown up, everything. And then, you know, she's already dilated it to like, you know, 10 centimeters. And so we're like getting ready.
Yeah.
To basically have the baby come out. So the our doctor that I had, like, luckily let us kind of help with that process, where he's okay, now put your hand in, like feel for the head area, so you can tell like is your face facing up or down.
Yeah.
And then like when the baby's about to come out, like you're the one holding it, so he'll like, okay, hold the baby, and then he's like, okay, put it on top of the mom, and then I'm like, okay, do this.
So you're very hands-on as a student.
Yeah, and then you get to cut like the umbilical cord as well, and to get like the cord blood, just to get that like sampled and everything like that. And then, you know, like after baby comes out, that's not the end. Like you have the placenta, so you got to massage and then take out the placenta, and then like basically scoop out any other blood clots. But I didn't get to do that part because like the doctor wants to make sure, you know, like everything's coming out.
Yeah.
And then depending, you know, on how the vaginal process goes, you might have to suture if there's a tear with the vaginal process or anything like that.
Yeah.
And then we also had like C-sections. We saw a couple, so that was pretty cool.
Yeah.
And it's interesting. Like when you like, you know, like do a C-section, when you close, you can either suture or staple. So it really depends on like the academy, like for OB-GYN, like what they recommend, and then that's what the physician usually goes by, like the guideline of how to close and everything like that. So that was
so it just depends, you know, their preference.
Yeah, their preference.
So as a student, what percentage do you do OB versus, you know, gynecology? Is it 50-50, or do you do more one? Depends on the preceptor?
I think it's more gyne.
Okay.
Because like for the OB part, for him is more like on-call shifts, or like if his patient was ready to pop, then we go to the hospital where they were arranged to go to.
Gotcha.
And then, but you know, clinic is like, let's say 4 or 5 days a week, so you're seeing more gyne patients than you are like OB patients. Like you'll have OB patients in between, but more gyne patients. Okay. Just like people coming in for their well checks. A lot of them just come in just to make sure, you know, their pap smears are normal, and like go from there basically. Right. So
gotcha.
Yeah, so it really just depends on like what shifts he picked up at the hospital. But like my preceptor had like so many hospitals he go to. Yeah. But then I only had access to one, but that one luckily was like the most hands-on experience one. Yeah. But I'm just like, he does not sleep. Like, like he just goes like clinic, and then he goes to the hospital. I'm like, when do you sleep? Yeah. I'm like, oh my god, yeah. Like OB-GYN specialists, like their time schedule is just so crazy.
Yeah, it's pretty crazy, I bet. Yeah. I don't want to fast forward, but we'll kind of talk about it later. Mm-hmm. But I'm kind of thinking that this is a specialty that is really up on your list, you know, once you graduate.
Yeah, only if they hire, because I think they're one of the specialties that don't hire PAs that much, because you do need them there for like the delivery process for the C-section. Because for surgery-wise, like PAs aren't like, you know, we're not the surgeons. We're more like a first assist basically, and helping and assisting with the surgery. Yeah. So we basically need, you know, like the physician there at all times for like that part. But if it's anything clinic-wise, we can do on our own and go from there as well, and then just asking for help if we need to like clarify anything. Gotcha. So crossing my fingers.
Can you be a part-time OBGYN and then a part-time another specialty? Can you do that?
Yeah, I think possible? I think it's like depending on like what specialties are per diem. Yeah. Then you can probably do that if they need help and need you to go in. Okay. Yeah, because I have heard like you could do 2 per diem jobs if you want as well, instead of just like 1 full-time. Like.
Yeah, I think that's pretty similar to physical therapy. Mm-hmm. I know some people did do 2 per diems because the pay is more,
Yeah.
and that you can be more flexible with your schedule. The only difference is that you don't get health insurance, so it's kind of different.
So
but
you gotta pay for your
but
own
if
health insurance.
money's up there, like
Yeah.
per diem is where it's at.
Yeah. But for you guys, like, let's say you're applying for a per diem job, did they ask you to have experience first, like when you do apply for that type of position?
I think it depends on the location that you're going to and how in demand that they are. If they're really needing it per diem, they're probably going to hire even new grads if you have no experience. But I think as a per diem, you only work a certain amount of days throughout the month. So they kind of expect you to have the experience, or at least if you already know how to work the software or the documentation system, that's even a bonus because you can transition really quickly compared to if you have no experience and you don't know the documentation system, they have to devote more time for training, which, you know, hospitals or clinics don't really, they don't want to do all that. But next up, infectious disease. I'm interested in this because I didn't really know about infectious disease until I started working in the hospital. So what even is ID?
So okay. So I think anytime like you're in a hospital and like somebody has like an infection or anything like that you can think of, you usually consult ID. So that's just because like you never know like what a patient, like what antibiotics they have taken in the past. Do they have resistant to certain antibiotics? So the ID doctor is the one who kind of like recommends like, okay, what kind of antibiotics, like what kind of medicine like we should administer for this patient so that, you know, the infection clears away. So for this rotation that I did, my preceptor was like a HIV specialist. So he saw a lot of like HIV patients in his clinic. And so all of them are stable though, like everybody's all good. Their viral load is undetectable. So basically the goal like at his clinic is just making sure all his patients are taking their medications on time, because if you don't take your, you know, medicine like every single day, your viral load can kind of like go up and down, and it can get worse because when your viral load for HIV is like high, you're more likely to get an infection. And then that's when everything starts going like downhill. You're like, you're probably going to get this, you're probably going to get this. And you're like, oh no. Yeah. So it's like the oral like thrush that you see, like those can happen when your viral load is just unstable. Like you're just more susceptible to like infection. Gotcha. And he sees a lot of syphilis patients as well and monkeypox. Okay. So that was pretty cool. So I didn't know this until recently, but apparently like Vegas is becoming like the #1 syphilis capital right now. So we saw so many syphilis patients.
Gotcha. So what is your role as a PA student in infectious disease?
So when I had that rotation back in March, so we would have 2 weeks of outpatient, 2 weeks of inpatient. So as a student for outpatient, we basically like see the patient first, ask them how they're doing, you know, their compliance with their medications, you know, and then recommending them for anal pap smears, just because when you have HIV, you're more at risk for that. Yeah. For like anal cancer or anything like that. And so this preceptor that I had, he had another clinic upstairs where they do those anal pap smears just to make sure, you know, like you're doing good, no risk of cancer or anything like that. And just making sure they're stable, and check if they are having any other labs done, like are their CBCs okay, you know, CMP, like all those stuff. But we would recommend them to see their primary doctor just because he's more of a specialist and he is a primary care doctor. Gotcha. And then for inpatient, we also basically pre-round without the preceptor. So we go around the hospital depending on his list of patients, and then we split the list with our other classmates that are there if we're on the rotation with them. And then we're like, okay, you have these people, I have these people. So sometimes like we'll round together just to make sure, like in case I didn't hear something, they heard something, then I can type that in their note. And we also pre-chart. We go see them to see how they're doing, like any, you know, for example, syphilis. If you get neurosyphilis, you get like vision changes, blurry vision or anything like that, right? Headaches. Yeah. So we check like, okay, are you still having that? Because you're on treatment, so that should be helping them recover from, you know, like blurry vision or anything like that.
Symptoms should be improving.
Yeah. Yeah, just to make sure they're stable, doing well, nothing new is like going on. So similar to like a hospitalist, but more specialized. You're like focusing on one condition, or, like the main thing that you're in charge of going in. Gotcha. Making sure you're doing well, no side effects for medications and anything like that. And then afterwards you go back and let the doctor know, and then you round with him. Basically. Okay. And then if we get like new like consults from the ER, then we go, like as students, we go see them first, and then we basically make a new chart including everything that we can find, any details, and then let our physician know, and also kind of put in like draft the orders that we want to order for them that's more tailored for ID. and then go from there, basically.
So when you're going to these patients, are you by yourself, or is your preceptor like right behind you, or shadowing you, or supervising you?
So outpatient, so we see them first, and then we go back in the room with them in case we need to change any plans. So in a way, like I'm drafting the note for outpatient first, and asking them all the important questions, and then he just goes in there asking them how their day is or how they've been doing, because he knows all these patients like for the back of his hand. Like he's seen them for years, and they're like been stable for years. So it was like just practice for us to make sure like we know what to ask them and getting comfortable with asking certain questions. Like, for example, like for our HIV patients, you know, like we want to make sure, you know, we're not transmitting it to anybody else or anything like that. We would ask like, oh, how many partners, you know, are you with? You know, getting comfortable with asking like, oh, what type of sex are you guys, you know, practicing?
Yeah.
So it's kind of like getting rid of the awkwardness. So that was good practice for us. And then for the inpatient part, so students ourselves would go around first in the hospital, and then during lunchtime, he would go around with us again. Just
is that nerve-wracking going by yourself?
Okay, at first it was, because like the hospital is so confusing.
Yeah.
Like when you take the elevator, you go to a certain floor, but it doesn't go up. So you had to like walk around and then go use the other elevator and then go somewhere else. You're like, oh, I guess I'm in the right place, right?
It's a maze. Yeah.
Yeah, and then you go and you're like, hello, are you, you know, or you ask a nurse. The nurses are so nice. So I'm like, oh my gosh.
Yeah.
So I'm like, can I go in? Like, is this the right patient? And then sometimes if the patient's not in there, then you go ask like the charge nurse or a nurse in charge of that patient, like, oh, what's been going on? Anything new? They know their patients like so well. So I'm like, thank you.
Yeah.
Saved my life. So I'm like, yeah.
Have you ran into physical therapists while you're doing any inpatient stuff? Because I run into PAs.
Oh, really?
Quite a bit, especially IDs. Yeah.
Maybe like one, like during my like inpatient medicine like rotation, I did run into like some physical therapists, because they were like helping patients like ambulate around like the hallways.
Yeah.
But I didn't see any like during my ID rotation.
Oh, okay.
Yeah, but I did see like nursing students that were there from like UNLV, but I didn't see like anybody else.
Gotcha.
Yeah. So.
Gotcha. So how does ID rank in terms of your interests?
I would say
high, low.
I would say like medium. Like I wouldn't mind, like it's a pretty nice like way to like learn more about like antibiotics, like more medicine related, because you do have to know like what you're going to give them, what's going to cover, because you don't want to give them like something that covers a gram negative when you need to cover MRSA, because that's like positive. You're like, oh shoot, I need to change this, you know, like Tubanco or something. So yeah.
Man, Sammy, I feel like you're a better student than I was, because as a student, I had my firm yeses and nos on certain specialties. Like pediatrics was a hard no to me.
Really?
Yeah.
No.
But for you, it seems like you're okay with a lot of things.
Yeah. I think I'm trying to keep an open mind.
Yeah.
So like in case I do jump around in the future, because I feel like your first job, or like my first specialty for like new grads for PA, it might not be like the one you're going to end up in.
Yeah.
So I feel like I just want to keep it open.
Yeah.
And then it's like, I feel like I have a patience for a lot of things. So I just take it as it goes. I'm like, I wouldn't know if I was supposed to be offended or not.
Yeah.
I'll be like, okay, let's just move on.
Yeah.
So.
Employers will love you.
Oh, thank you.
Orthopedic surgery. You did that one, right, already?
Oh, I'm in it this month. So
okay, let's talk about it.
I just finished like 1 week of it.
Okay.
It's pretty good so far. So clinic is just a lot of like steroid injections that you just watch like your preceptor do. And then, so he specializes in shoulders and knees. So you just see shoulders and knees the whole day. You're like, I have knee pain, or I have shoulder pain, or my rotator cuff is like torn.
Yeah.
Like a lot of them are confirmed, you know, like with imaging. I like how straightforward it is, because it's like you do all these like lift off, like Hawkins test, whatever. And then you look at the imaging, or you're like, okay, let's order imaging so we can confirm what this is. And then go from there of how we want to do treatment. So usually like you do conservative treatment, like with injections or physical therapy. So we do a lot of referrals to physical therapy. I was like, oh yeah.
I'm glad.
Yeah, I know. I was like, you should. I was
Please
like, let's
do.
go.
Yeah.
Yeah. And then after that, if conservative doesn't work, then they do surgery. But some patients just can't stand the pain and they just want to, you know, go straight to surgery. So that could be an option sometimes.
Gotcha.
And so I had 2 days of surgery this week. So the first day was like a lot of scopes on like the knee. So I got to see that. So that was pretty cool. I haven't seen any on the shoulder yet, but I feel like that's going to be more confusing to look at.
Yeah.
I'll be like, oh, I don't know the orientation. Like what's this and what's that? And then I saw like the knee replacements. That was really cool actually.
Yeah. Oh man, I wish I could be in an OR and just look at replacements.
Yeah. Cause like, a lot of my, I don't know if it's a lot of my classmates, but I hear like like a couple that want to do ortho surgery.
Yeah.
Because, like they're just buff people. And I'm just like, is that like a
Mhm.
stereotype? Like, I don't know. But
Yeah.
they're like, yeah, you hammer the, like what out of the bone? And I'm like, really? So when I saw it this week, I mean, like, yeah, you hammer, but you don't like hammer like super hard because, you don't want to break anything.
Right.
So that was pretty cool. And they're, shaving part of the bone off and then putting on like the metal part and then putting on a plastic part and then a metal part, like a sandwich. And
Yeah.
for the knee.
Gotcha.
Basically. So that was pretty cool. And I was like, wow. I was like, I can see myself doing this. Like,
Yeah.
it's
Why
pretty
not?
fun. I like how direct it is, like OB-GYN, because it's like you most likely would probably have this or this as your diagnosis, probably. Like when you start seeing the patient and thinking in your head what the differential is, I think it's just more direct. And I'm like, oh, this is pretty straightforward. I think I can do this. Like, not too bad. But
Definitely.
yeah, so I'm like, maybe in the future, but not like something right off.
Right away.
I want to build like my skills first, like have a foundation of like overall before specializing.
Gotcha.
But,
So you just finished your first week, so you have 3 more.
Yeah, 3 more weeks left.
3 more weeks.
Oh,
Gotcha.
Rotation goes by too fast. So.
Yeah.
Oh, yeah.
So you sent me other specialties. I'm gonna just list them out, and at the end of it, I want you to let me know which ones you're most excited for, or if there's any one of these that you want to give any interesting facts about, some misconceptions or people may not know. So the rest of your rotations, you're going to have family medicine, community medicine, plastic surgery, urgent care, and psych. Out of all those ones, which ones are you going to be, pretty excited for?
So I think like the most, I guess, like the one that I look forward to most is plastic surgery, just because I feel like it's more hands-on. And then so this rotation I'm going to have like later on, the preceptor focuses more on like breast reconstruction. So I thought that's pretty cool because, like when people think of plastic surgery, it's just the facial aspects, where, like the nose job, I don't know, like the Brazilian like butt lift or something like that.
Yeah.
But there are more to it. Like it's not just for like cosmetic reasons, but it's also for like medical reasons.
Yeah.
So I feel like that's like the main conception about plastic surgery, where everybody just thinks, oh, it's so I can look like Kim K or something like that.
Right.
But, like it's, that's not true. Like sometimes, let's say like you got like a laceration like near your eyelid, like it's hard to just suture up and not have a scar. Like you want to go see,
or if someone even has burns on their bodies, burn team would go in, but also plastics would probably be consulted if it's severe enough to where they would fit in. But I think that's pretty interesting because it's a misconception that plastics is probably only facial features, but there's a lot of different things that they do, which is probably super interesting and keeps them, keeps them going.
I know. I was, like,
so plastics
excited.
is coming up. When do you do plastics?
In September, so.
Oh, okay, so pretty much closer to when you graduate.
Yeah, and that's my elective, so I don't have an exam, so I can just enjoy it and just learn. And I want to know how they suture, because, like, like plastic surgeons are really good at suturing to make sure there's less tension on the skin for less scarring. Yeah. So I want to know what the key to healing really
and that and that would make a big difference because. If you do something wrong and it doesn't heal the right way, someone will not be happy.
Yeah, and that's why, like, you sign papers, you're like, okay, well, if this happens, like, that's how, different clinics protect themselves, regardless of the specialty.
Right. Yeah. Gotcha. So these are some other specialties that you're not going into, but some of your other classmates are going into. If you hear one of them and want to talk about it, just let me know. But the rest that a PA student could do is vascular surgery, general surgery, NICU, ICU, cardiology, wound care, endocrinology, neurosurgery, which is probably one of my favorites, dermatology, ENT, so eyes, nose, throat, rheumatology, interventional radiology, and pain management. Any one of those that, sticks out to you in terms of, as a PA student, maybe watching this, like, okay, this is a cool specialty.
So for like my cohort, or like just in general, I think interventional radiology was like a very popular option, but very limited. But I think that's one of like the most hands-on rotations that everybody wants to do.
Really?
Just because like a chest port or something like that, you get to be hands-on and kind of like help with it, or you can do half of it yourself or something. Because one of my classmates had it and she was able to do a lot, like hands-on.
Oh, I did not know that.
Yeah.
I thought it was more so reading imaging and like taking
Yeah.
just taking imaging?
No, that's more like radiology.
Just
Like,
general radiology?
Yeah. But like interventional is more like, let's say you had to put something in and then like kind of like a drain. And then, you know, you need to use imaging to make sure you're in the right area for the drain and then put that in, kind of like for like appendicitis kind of thing.
Gotcha.
Similar to that, then we might need like interventional like radiology. So like IR for short.
Oh, okay.
Or like, depending on like sometimes like certain ones you would need those specialists to come in, but it's like a very popular field right now is what I heard.
Yeah.
So I was like, I heard it's really good.
Yeah.
And then neurosurgery too, like,
Oh man,
like-
that's so
like,
interesting to me.
yeah,
I
I
love
know.
neuro. Neuro is
Yeah.
one of my favorites.
like our friend like Francis, he's like, oh,
Yeah.
I love it. I was like, I want to do this again. So he might do this as like a second rotation again to add on
Yeah.
as like elective. And he just said it's really cool to see. I
Yeah.
want to put that on my list, but I'm like, but there's only so much I can put on my list of what I could do. So I just chose like ortho and plastic surgery on.
Yeah.
For it. But I would want to do neurosurgery if I had an extra elective.
Okay. Gotcha.
So,
Nice.
yeah.
So let's kind of wrap it up in terms of, you know, PA. I want to ask this question actually.
Yeah.
You know, as a student, maybe giving advice to someone who's wanting to go into school, why should someone pick PA school versus MD?
So I think it's like a personal preference. So you had to think about your personality, what you want to do with your life, what your interests are. So like for me, when I want to do PA school, it's because I felt like it worked with my personality and like it just goes well. Like, I don't know. For some reason, I'm just like, oh, I feel like I like doing this. And it's like a team like effort. And I really like working in the group and collaborating. I don't just want to fly solo because
Yeah.
I'm like, it's going to be lonely out there.
Yeah, I know.
Yeah, you know. So I really like that aspect. And you can just work with so many different people. And I like, you know, being able to do that because everybody has a different work ethic and you can take away from that.
Yeah.
And so, yeah, the learning style, you're just able to constantly like learn, like as mentioned before, and then just basically venture out to see what suits you, and that flexibility for like different specialties you can go into.
Yeah.
I think the work-life balance is really important, but I think like the number one thing for me was like it just worked. I just felt like it matches how I am as a person
Yeah.
more than an MD is, because also for me, like I like school, don't get me wrong. I think just for me, I'm like, will I be able to handle that amount, you know, like a schooling plus residency and a fellowship, you know,
It's
like
years and years
yeah,
on top
like,
of what you would be doing.
yeah, I like applaud like all my friends that are going through med school, you know, about to, you know, start their residency, or, you know, like after that and then go into their fellowships. Like that's you, that's great. Like I just don't know if I can just focus on one field
Yeah.
for like the rest of my life. But
Definitely.
I just think there's just so much out there that I just want to look into.
Yeah.
So that's why. But yeah, no, but like people that are like, you know, like want to be an MD or DO, they're great too. They probably have similar personalities to me. I just felt like it just felt right. Like, you know how like when you want to be like a PT, you're like, okay, this is like what I want to do. Because you had that moment where it's like, wow, like this is like what I want.
Yeah, it was
know?
kind of an easy decision for me. It clicked right away. So, you know, I think not a lot of people get to experience that feeling where like, okay, I want to do this and this is it. Some other people, it may take them kind of a longer time to realize, but it seems like you really enjoy,
Yeah.
you know, wanting to become a PA.
Yeah, I think everybody just needs to have that moment where it's like, okay, I can see myself do this. Or you're like, okay, yeah, I want to do this. I think when you have that moment, like, it'll be easier. So I think, like, for anybody that's confused, it's like, yeah, just shadow them, see what they are. Like, I know, like, a lot of factors play into it, you know, like, there are expectations out there. But, you know, at the end of the day, it's like, okay, like, what do you want? Like, do you see yourself doing this in the long run? Because if you don't, then don't choose that, you know, because you don't want to regret it, you know, like, so you just want to think of everything and what works for you. This is cliche, but everybody's like, whatever makes you happy, but whatever makes you less stressed, you know, thinking about the future.
Oh, yeah.
That you're comfortable with, that you're like, okay, yes, like I want to do this, then just go for it.
Definitely.
Honestly. So
that's how I felt. I can kind of considered doing a medical doctor, but I thought about just the responsibilities and the amount of schooling. And it's not like I probably wouldn't be happy. It's more so, you know, stress levels. Like you said, it's whatever is going to be less stressful, but still give you the satisfaction in life.
Yeah. And then also like PA school is like shorter. So I feel like you're able to go out, you know, in the community faster to help patients. So that's what I really like. Like the schooling is shorter and it just gives me like brings me a step closer to seeing my patients earlier, which is like something that I like too.
Yeah.
Because I just want to be out there, be hands-on, and learn more.
Yeah.
Like that's just what I like. So I'm just like,
Definitely.
yeah. Like I love school, but I feel like I've been in school since I was 3. So
Yeah.
I'm like, I need to stop.
Spread those wings and
I know.
fly.
I'm like, I need to learn what it's like to be an adult, what it's like to be a provider, and like,
Yeah.
you know, like work on my life. I'm like, yep.
Yeah.
I'm old.
I'm close to being 1 year out of PT school.
Mm-hmm.
And during PT school, I kind of really liked it. You know, I loved studying.
Yeah.
I loved spending hours studying. But now that I'm 1 year removed from it, I don't see myself wanting to like do it over again.
Oh,
Because
really?
being a clinician is great.
Mm-hmm.
Like you get to actually work with patients that you love working with, and you get to challenge yourself every day. So it's great. So you are close to graduation this October. You're going to be graduating from Toro. What is life like after graduation for Sammy? Do you plan on, you know, applying for certain positions, certain specialties? Do you want to stay in Las Vegas? What is life like?
So after graduation.
After graduation,
Should
once
go on a
October
trip.
comes. Yes.
Yeah. But okay, so let's talk about, I guess, like post grad. So I'll take my boards like a week after like whenever my last day of classes. So I already bought like the exam and everything, like the fee. Oh my god, that was so much money.
Yeah.
But so yeah, I already have my board set to take it, like the first week of November, and then afterwards I'll be going on vacation.
Let's
most
go.
likely on a trip with classmates, hopefully.
All right.
We'll see how, because there's just so much to plan. You're like, you don't know who's busy and who's not. So
Yeah.
we'll have a trip, and then I'll probably apply for jobs like near the end of my trip just to like get it started. And then in terms of like what places I want to apply to, like probably Las Vegas and like SoCal,
Okay.
and then go from there and see. Like obviously like California is like expensive, but I feel like I have seen so much in California as well in the medical field that I feel like it's a good learning opportunity for me out there too. So I would want to do either or, whatever has a good pay, whatever has good benefits, honestly. Whatever seems like a positive vibe type of like clinic or like hospital, then I'll go to. Like whatever, like, you know, you feel like you would, I guess, blend into, like work well with others, basically, like based on the atmosphere that you see. And so maybe start looking for jobs around like January or so, since I'm graduating like end of Halloween-ish, like beginning of November.
Yeah.
And then, you know, student loans are only grace period of 6 months. So I'm like, okay, I need to have a job before like March or something.
Yeah.
I'm like, okay, so I'm secured, you know.
Right.
But between that, I think I would just relax. Hopefully I pass my boards.
Yeah. You will.
Yeah.
I know
I'm
you
like,
will.
Okay,
You're very
pass them
smart
out.
and
Thank you.
dedicated to your craft. So I have no doubt about it.
Yeah.
Is
And
passing rate pretty high for Toro?
I think usually like the passing rate for any program is like high 90s.
Okay.
Like that's like expected. So I think they changed the boards recently, like I don't know, like a year or two ago. So like the percentages kind of dropped, but it's usually around like 95, 96, 97. And they try to encourage everybody to take it within like the first month after graduation.
Yeah.
Because there's a thing where it's like the longer you hold it off, the more your, you know, score can lower, like 1 point a day or something
Right.
like that.
That
so
makes
you want
sense
to
to me.
take it as soon as you can.
Yeah.
So we'll see. It's like a 5-hour exam for us.
Yeah.
How long was it for you?
It was like 4.5.
Or a half?
Yeah, but depends how long you take your breaks, because you have these optional breaks and you have mandatory breaks, and some people just go through the whole thing.
Yeah.
And then your mandatory breaks, I think it's like 30 minutes mandatory, but you can choose to do 1 minute of that or 30 minutes. I chose to do the whole 30, but
Okay.
yeah, those tests are very long.
Yeah.
And just the idea of you taking a board exam where your license is on the line, where you either pass it and you don't, it's very nerve-wracking.
Did you guys find out like right after like what like the tentative score is, or?
We found out probably within the next couple weeks.
Okay.
And that time period was very stressful.
Yeah.
But
Any ways to cope with that?
Yeah.
Yeah, like with the waiting game, like what did you do?
I just hung around with a lot of friends, family, classmates. After the board exam, me and my friends or my classmates really just went out and had fun.
Yeah.
But just knowing that, so with physical therapy, the board exam, a lot of people say that you're going to leave that exam feeling like you failed. Like everybody says that. And so, you know, when I left the board exam, I thought I failed. I was already looking at the next board exam. I was like, okay, I'm going to pay for this date in a couple months.
Maybe I should pay for this right now.
Yeah, but the fact that it's pretty notorious for the PT board to feel that way and majority of people pass, I already had that in me. And I was like, okay, even though I'm super stressed right now, probably I'm going to pass just like anybody. So
Yeah.
it wasn't that hard to, you know, kind of
Yeah.
find my own groove and calm
Yeah.
down afterwards.
Yeah,
But
like once you go in, you're done. You're like, okay, I'm done. Let's just
Yeah.
relax and wait.
Yeah.
Yeah.
I'm super excited for you to graduate and kind of go on with, your postgraduate life.
Oh, thank you.
Is there anything else that you want to mention? Any advice for future PA students in order to be successful through school?
I think like the most important part is having for like pre-PA students
Yeah.
is like the clinical hours. The sooner you start getting your hours like during undergrad, the easier it is for like their life when they apply, because a lot of people like it's okay to take gap years and stuff, like if you're the type just to take your time, but if you like really want to like get ahead of the game, try to start getting more exposure and more hours in for patient care, so that you'll have enough by the time you graduate to apply for school. And just at least having a lot will give you like a good like competitive edge in a way. It is getting harder these days. Like it's hard to tell, like just because you have these numbers doesn't mean you're gonna get in. So honestly, just trust the process. Like whatever you write on your essay, make sure it's all about you and why. Like what really sparked that interest in you, and like why do you see yourself doing this? I feel like as long as you have the determination, regardless of how spectacular or how like you're worried about your grades are, it's okay. Like at the end of the day, a program's gonna be like, I want you, like you'll be fine. Like,
Yeah, definitely.
So
It will all work out at the end.
so I'm like, I think just take it with time. I think that's it,
Yeah.
honestly. Like it really depends on the person and their experience, but I think as long as you get ahead of the game, know what classes you want to like take to make sure you get into the program that you want to go to.
Right.
I think that's all there is, since it varies so often.
Do your research, be prepared, and
Yep.
it will all work out.
Yeah, it'll all work out.
Yeah.
I know.
Well, thanks you for, joining